What sort of legacy do you want to leave behind after your tenure is over?
Cicely, I want to not just be the face of delivering UHC, but I want to be in a position to have touched the lives of the poor of the poorest by way of ensuring that health care at the very, very basic level is not just accessible, but it's one that is of quality and exposure that is a good experience to the persons who are being treated. I do recall when I was growing up many years ago, going into a public hospital with a brother of mine with an ailing spouse, and so my brother sought to find out what is the problem, why is she suffering from, and he used the language like kesi yake ni nini. And he was told, the doctor looked back and said, this is not a police station that should come and ask for kesi. Si mambo ya kesi hapa. You know, a feeling which many years later, many decades later, I can relate with, because that is not how then you handle a sick person. A sick person is already a sick person. They require compassion. They require tender care. They require just to be appreciated in the way they are. So I'm looking for a day that I'll look back and say, you know, we brought care that was both humanly delivered, but also that had a lasting memory to the person who has gone through the experience of care. That simply as it sounds will require for some hard work, will require for some change in culture and attitude, will require for teamwork, because you know, teamwork in a very complicated environment where delivery belongs to one part of government, that is a devolved structure, and policy, standards, monitoring belongs to the national government. But so far, I have no doubt that that can be done and will be done.
Okay.
Yeah.
Okay. So, any final comments?
I mean, it's always an exciting day to wake up and be able to serve in this very complicated sector. It's very exciting for me to be able to say, to see a team that appreciates that we sort of want to change the way we have delivered service to Kenyans, and they are willing to be led then to be that team that will look back and say we were part of that great legacy, and that we actually did not disappoint, that we supported the president in living his legacy and his vision to ensuring that universal health coverage becomes a reality. So that just gives me a lot of motivation to keep going.
Okay. So Capital FM wishes you all the best in your endeavors, and thank you for giving us this interview.
Thank you very much. Thank you.